So today you can see I'm wearing a compression sleeve because I have something called AWS, it's Axillary Web Syndrome. I've talked about it before. I went to occupational therapy yesterday and she recommended I wear this to help treat it. So essentially it happens to a lot of people who have had cancer, breast cancer specifically, and had lymph nodes removed. You see this cording right here in my arm. It goes through my armpit and it stunts my range of motion. This is as far as up I can move my arm, up and then out, and it spans from my armpit right here all the way to my elbow. So it's like a rubber band being pulled, just what it looks and feels like. It is caused from the surgery and them cutting into the lymph nodes and removing them. I had 4 lymph nodes removed. Some people have 8, 10, 12, depending upon if it presents that they have cancer. The lymph nodes are also, they put dye in during surgery to see the pathway because they're like a cluster of grapes and they want to see which way the blood flows through them, and they take them out and have them tested through pathology to see if there are cancer. Yes, mine were not cancerous, thank the Lord. So they show up as a tight rope-like cords under the skin in the armpit, sometimes extending down to the inner arm, to the elbow, or even to the wrist. Mine stops pretty much at the elbow. They are thought to be inflamed and hardening lymphatic vessels or scar tissue. The symptoms are tightness, pulling, or pain in the armpit, arm, and chest. So I noticed my symptoms right away after my first surgery, but you don't know what is what and what's caused by what when you first have major surgery like the bilateral mastectomies, because you're swollen, you're all sore, tender, you're in pain from cutting you. You pretty much don't know what's what. I had this from the beginning, from the first surgery, but I thought it was a result from the surgery. And I haven't been able to get it treated because I had back-to-back surgeries. So now I am able to get some work done on it. There's discomfort when lifting the arm above shoulder height. I can't lift mine above shoulder height, and it makes everyday activities like reaching, stretching, or carrying items more difficult. It definitely has affected my ability to put on a t-shirt and take it off, a shirt without buttons, because especially initially after the surgeries, I couldn't lift my arm up. It definitely has affected just putting on and off clothes. You never really think about it until you're in it and you take things for granted. Reaching up in my closet, which I mentioned before, is also a problem. I had to buy a step ladder because I couldn't reach the top shelf to grab things from my top shelf. So that is a problem as well. And then washing my bag, I bought these African sponges in order to wash my bag because I had no problem before surgeries. I can't wash my bag myself. Why it happens? Usually linked to surgery or lymph node removal, which I stated before, sometimes worsened by scar tissue or reduced lymphatic flow, and can appear days to weeks after surgery, but also show up later during recovery. The treatment and management. Physical therapy. I have my first physical therapy appointment next week. Occupational therapy, which I'm in now. She gave me some exercises to do, which I've demonstrated in previous videos. She's also doing massages and manual therapy. So the massage was kind of painful because she's stretching them out, and she's even stretching them until they pop, make a popping sound and feel to it. And so that's something that she does as well. She also gave me some exercises to do myself, which is taking my hand here and then doing deep circle to massage, and they feel really tender and sore today because she did do the massage yesterday. You can also do heat and massage. It softens the tissues before stretching, so I will try some heat on it to see how it makes it feel. I have a heating pad, or I have icy hot and biofreeze. And consistency is key to healing this syndrome. The cords may retighten without regular movement, so you have to keep moving it in order to keep your mobility. I do see it in my mom. My mom had surgery 42 years ago ish. She had a mastectomy because she had breast cancer, and she pretty much right after, I guess she didn't do exercises or go to occupational physical therapy. She's not able to lift her arm all the way up. So it was like she got frozen shoulder from it. The outlook for it is uncomfortable. I agree with that, but treatable and not permanent. With therapy and self-care, many people regain full range of motion within weeks to months. Every intervention helps prevent long-term stiffness. So basically, if you don't move it, you're gonna lose it. Just keep moving it, keep exercising, keep trying to regain your range of motion. So that's what I'm trying to do. And from talking to my therapist, she said that it is very common side effects of breast cancer surgery. It really isn't talked about enough. When I had met with my surgeon, she did tell me that there are some side effects. I have to regain the range of motion in my arm. She didn't really call it AWS, and it can be painful and limiting. But with the right therapy and consistent movement, you can recover mobility and reduce discomfort. Sharing this helps raise awareness for others who may be struggling silently. Some people are like, don't want to go to the doctor, don't want to see about maybe aches and pains that they may have, but it's important to, and I am one of those people, I wait till the last minute to go to the doctor, not unless I know from experience, from having whatever it is before, that I need to go. You have to make sure you keep on top of your recovery and your healing, especially when you have had major surgery and you had a disease or chronic illness or chronic condition. You have to make sure you're keeping on top of your care. Because I wasn't even going to go to the doctor when I got ill last week. I thought I just really had a cold or sinus thing. So had I not gone, I would not have known how serious it was. Just have to be mindful and be gentle with yourself and just be self-aware of what's going on with your body. That's it with AWS. If you have any comments or tips and tricks you want to share, please leave a comment, or please feel free to share this information with someone else, because sharing is caring.